Goal Foundation, dedicated to powering social innovators to transform the world. Learn more at skoll.org. And Jarl and Pamela Mohn, focusing on civil liberties, foster youth, public radio, and the arts.
This is Charlotte Talks. I'm Mike Collins. After being virtually eradicated, measles is back. This highly contagious and potentially life-threatening disease was all but forgotten thanks to childhood vaccinations. But now, because we've forgotten how this childhood illness can run rampant through populations, and because of lower than normal vaccination rates, measles has returned. This year, around the country, we've had more confirmed cases than at any time since 1992. And in this area, the upstate of South Carolina has been a hotspot. Yesterday, the South Carolina Department of Public Health added 8 new confirmed cases of measles in Spartanburg since Friday, bringing the total number of cases in the current outbreak there to 30. The total number of cases for the state, I believe, stands at 33. South Carolina DPH says the number would have been higher had it not been for rapid containment efforts, the quarantining of exposed individuals, which they say has been highly effective in preventing wider community spread. Measles is just one of many childhood diseases that used to be common but are now distant memories due to the vaccines developed to keep them at bay. The resurgence of measles may just be the canary in the coal mine, warning us of the impact of vaccine skepticism and lower vaccination rates. So this hour, a closer look at measles, how the rise in the number of cases in this region compares with other parts of the country, and what this means for public health. Dr. Raynard Washington is Mecklenburg County Public Health Director. He is here along with Tom Corwin, health reporter for the Charleston Post and Courier, and Josh Michaud is Associate Director for Global and Public Health Policy at KFF, which provides nonpartisan information on U.S. health policy. Good morning, everybody. Thank you for being here. And welcome back to Dr. Washington. I'm going to begin with you because I want a little primer here on measles. Measles is said to be among the most contagious infectious viruses known, which actually surprises me. One case often leads to 20 more. What makes it so infectious?
It's just a highly effective virus. It's able to spread very easily. It's a respiratory virus. And so, as we know from our other respiratory viruses, if you are, it's hard to control respiratory droplets when people are in spaces, close spaces where they're talking, particularly given its disproportionate impact on children. Kids tend to be in very close contact with one another as well as with adults. And so, of course, increases the likelihood of transmission in settings like schools, childcare facilities, etc.
So older adults alive today probably got the measles at one point in their lives, but there are a whole bunch of people who have never seen an outbreak of measles. So tell us, when you get infected, how does it affect you?
Yeah, so most folks when they are initially infected with measles, they start to have symptoms in the first few days, but typically within the first week or two, they have things like a fever. There's a signature measles rash that individuals may have. They also may have symptoms very similar to other respiratory viral symptoms, like common cold symptoms, like a runny nose. And then essentially, some individuals will recover from the infection without any medical intervention, and other people, unfortunately, will have more severe consequences that can lead to pretty severe health consequences, and of course, even death, as we've seen in some of the outbreaks here domestically this year.
I sometimes wonder when I watch these old television shows that take place in the 19th or 18th century how people lived in those times very long because of the lack of medical knowledge. And yet, as a kid, I had measles, I had mumps, I had chicken pox, and they probably gave me a baby aspirin to take down the fever, which is something they don't do anymore. And yet here I am today. And I don't remember much about getting the measles except blotchy skin. And I don't know if my parents were worried about measles being a life-threatening disease at the time, but it is one. What makes it so? And is it only life-threatening in rare situations?
Well, I think it is, as with every virus that we talk about, everyone's body responds differently to infections. And so sometimes the immune system has an overreaction to a foreign agent like a virus or a bacteria that causes other symptoms in the body. And so measles is no different. And so as your body is responding to or reacting to the virus's presence in your body, it can cause various types of symptoms, things that can cause pneumonia, it can cause symptoms in the lungs, it can also cause swelling of the brain. So there are a whole host of different types of manifestations of the infection, as well as your body's response to the infection that can lead to complications that could threaten life.
Tom Corwin is with us. He is a health reporter for the Charleston Post and Courier. And although the outbreak of measles in South Carolina has pretty much been confined to the upstate, he's been doing extensive reporting on this. And Tom, the Washington Post reports also that the states of Utah and Arizona have recorded more than 100 cases in recent weeks. In Texas, they've experienced their worst outbreak of this disease in decades, where less than half of the kindergartners in Texas have been vaccinated against measles, mumps, and rubella. Tell us how these cases began in South Carolina.
Well, we're not really sure because the state hasn't released a lot of information, but the first two cases were related. That was in July. There was a sporadic case in September, and then we saw the outbreak start in Spartanburg County in early October, October 2nd. They identified a number of cases, and they released information sort of sporadically, but then we were told it was centered around two schools in Spartanburg County, Fair Forest Elementary and Global Academy of South Carolina. One of them is a charter school, and a number of students, about 150, were then told to quarantine at home because they had been close contacts of the first cases. And then as this went on in the following weeks, some of those students then also became infected, about a dozen of them.
The first case, as I understand it, and maybe you just said this and didn't give a year, but I think the first case was reported. The case in July was the first case reported since
Yes.
2024. And that person, as I understand it, was unvaccinated and did not have immunity due to a previous infection. When cases like this, when something like this crops up in a state like South Carolina or any other state for that matter, how quickly and how seriously do public health officials take it? I mean, one case of measles, is that a big deal?
I think they do take it seriously and they do contact tracing. So they go immediately to where that person is and try and find people who've had contact with them and try and quarantine them. And I think that was done last year with the sporadic case, which was travel related. Somebody went to another country, came back, and was infected. In the case of the outbreak, again, I think they're doing the best they can to try and find, particularly in a school, it's very difficult, all of the kids who have been exposed and getting them to quarantine. That quarantine is over, by the way, for both of those schools. They've
Yeah.
been 21 days out. So they're back in the community. And now we're pretty much seeing community spread at this point. Any case that comes up now is just presumed to be part of the outbreak because it is spreading in the community.
You also report that Dr. Stephen Thacker, a pediatric infectious disease specialist at the Medical University of South Carolina, was surprised that it took until July for South Carolina to report its first case since 2020 in 2025. Why was he surprised?
I think because we had cases in Georgia, in Florida earlier, so around March. In fact, we did a story in March saying that it was very likely South Carolina would see cases this year just because of the widespread nature of the cases in the country and because of our low vaccination rate. And at that point in March, the experts were telling us that it would be in the upstate because of the low vaccination rate in that area, and that's what proved to be true.
So, Dr. Washington, if I'm not mistaken, North Carolina has had one confirmed case of the measles this year, and it happened to be here in Mecklenburg County in June, and that number hasn't changed since then. You've said that these outbreaks in South Carolina, however, quote, put our residents at greater risk because of the frequency at which we exchange people going back and forth. I mean, Spartanburg is what, 90 minutes from here, if that. But our numbers continue to be low. Does that surprise you? And if so, how do you explain it?
Well, just a quick clarification. We had a case of measles last year. The case of measles that was in the state this year was actually in another county. It wasn't here in Mecklenburg.
Okay. All right.
Yeah, so I think certainly I will note, as Tom just mentioned, the vaccination rate here in Mecklenburg County, despite the growing number of kids who are not vaccinated, overall our vaccination rates still are well above 90%, which does give us a level of protection that is better than in some other areas or communities near us. As you already mentioned, the risk of individuals being in close contact with folks who, when there is community spread in a community and our residents go down to Spartanburg or to Greenville, it does put our community at risk. And so, as we've seen in other states that have border communities, it starts to spread pretty quickly.
I think Tom reports that somewhere in that on average in South Carolina, their vaccination rates are between 85 and 92%, and that's below the ideal rate of 95%.
95.
And you've said, Dr. Washington, that we're in the 90s someplace. Let me ask you this: if you are vaccinated for the measles, or if you've had the measles, which gives you immunity to getting it again, can you be a carrier? Could you go to Spartanburg, be exposed to somebody who has it, not get it yourself, but bring it back with you in some way?
No, I mean you would have to be you have to have a lot of infection and be shedding the virus to be able to spread it or transmit it to someone else.
Okay. Josh Michaud is also with us. He's the Associate Director of Global and Public Health Policy at KFF. And as I mentioned earlier, in the year 2000, the United States achieved measles elimination status. That's great, but it seems to have taken a very long time for that to happen because the first vaccine was issued in 1963 with a new, safer version issued in 1968. That means it took somewhere between 32 and 37 years to essentially eradicate the measles with this vaccine. Given the recent outbreaks in the last 5 years or so, how quickly might that reverse itself?
Yeah, it's certainly something that we need to be concerned about. I mean, just a brief history of measles elimination. As you said, the vaccines were available since the 1960s, and we saw, in fact, the first effort to eliminate measles. A federal effort, a nationwide effort to try and eliminate measles back in 1966. That was stated as a goal for the federal government to eliminate measles. And of course, we didn't get there until 2000, as you said. But, it took having large outbreaks, particularly in the 1970s, where, numerous children died of measles and people perceived the high risk from the disease that caused states to enact the vaccine mandates for school age entry, including for measles. And so when these state level mandates and spread, and basically all 50 states since the late 70s have had these school mandates, we've seen vaccination rates for measles over 90%. With the situation that we have now, which you've already referenced, is that we're starting to see chipping away at this level of protection. And, because measles is so contagious, when you're at 95%, you need to have that level of protection to interrupt transmission in communities. We had 95% coverage of measles vaccine nationwide in 2011, but that's now dropped to 92.5%.
And something similar is happening with other childhood diseases. We'll talk about all that when we come back.
On Thursday, in lieu of Charlotte Talks, we'll bring you highlights of a forum between candidates for Charlotte Mecklenburg School Board. The candidates answered questions on issues from test scores to school funding. Hosted by WFAE and the League of Women Voters of Charlotte Mecklenburg and moderated by WFAE's education reporter James Farrell. Join us tomorrow at 9 on 90.7 WFAE.
Italy's Winter Olympics opens in 100 days, and the once peaceful village of Cortina d'Ampezzo has already begun preparing. Some locals aren't happy with the millions that the town is pouring into construction.
Simple things that can make the town much nicer. That is more important than the Olympics.
I'm Elsa Chang, worries over the Olympics' impact on the next All Things Considered from NPR News.
Join us today at 4 on WFAE, where support comes from Brooks Pierce announcing the opening of its new office in Charlotte, further building on the firm's 128-year legacy of providing legal counsel to North Carolina's businesses and organizations. Details at brookspierce.com. And by the Charlotte Symphony, presenting Beethoven 360, narrated stories and works performed in the round aim to reveal a new perspective of Beethoven. November 7th and 8th at Booth Playhouse. Tickets at charlottesymphony.org.
It's Charlotte Talks on listener-funded 90.7 WFAE and WFHE. I'm Mike Collins. We're here with Dr. Raynard Washington, Public Health Director for Mecklenburg County. Tom Corwin is a health reporter for the Charleston Post and Courier, and Josh Michaud is with us, Associate Director of Global and Public Health Policy at KFF, and we're talking about the resurgence of measles around the country. The local outbreak would be in upstate South Carolina. They kind of quelled that by now, but we're going to talk more about how that happened and why it happened. And you just mentioned, Josh, that in the 70s there was this outbreak of measles that caused a number of children to die because it is a life-threatening disease for some. And I don't remember that. And maybe that's part of the problem, that people don't remember that and they don't remember the measles. Is that part of the problem?
Yeah, certainly when people don't see the effects of having children vaccinated against these diseases, you tend to forget what the risks they bring. We've seen an ebb and flow of vaccination rates over time. And usually when there's a resurgence of a vaccine, you tend to see the public realize that there's a risk. And then there's a push for more vaccination rates. In California, for example, in the 90s, there was outbreaks of measles, which led to more stringent vaccine requirements there in reaction to that. What's interesting now is, despite the fact that we've, as you said, seen more measles cases this year since 1992, we don't see the same sort of reaction, at least not yet. And we haven't had, in fact, we've seen states take steps back and relax these vaccine requirements. We've seen Texas, we've seen Florida, we've seen West Virginia and other states actually, introduce more, choice for parents to take exemptions from these vaccines. And, it's just a different mindset. And I think that's partly due to post-COVID, and we can talk more about that. But yeah,
we've had outbreaks of measles this year in Texas. I think that including the first known measles death since 2015. There have also been outbreaks in Alaska, California, Georgia, Kentucky, New Jersey, New Mexico, New York City, Rhode Island, and now South Carolina. Josh, what does this tell you?
Well, it tells me that, the decline in vaccination isn't even across states. And it's really, there's pockets where we've seen greater declines in childhood vaccination rates. And so we've seen that in certain cities or counties or communities, there is a lot of vulnerability to a very contagious disease like measles. And so what we're seeing now is the result of this decline in this clustering of unvaccinated children. It's a reflection of this overall trend that we've seen in declining vaccination rates. And there's every reason to believe that this will continue unless we're able to reverse these trends and get more children vaccinated, unfortunately.
So Dr. Washington, given the vaccine hesitancy, let's be nice about it and call it that, or vaccine skepticism, which has led parents to not get their children vaccinated, and that is leading, certainly, it's playing a role in this rise of cases. So if that continues, and it doesn't just involve the measles, are we likely to see outbreaks now of other diseases that we thought were gone, like rubella and polio and whooping cough and diphtheria?
Yeah, and it's actually happening in real time. It may not be getting as much press as measles, but we are seeing that in real time. And I did want to acknowledge that there's a really large outbreak happening right now in Arizona and Utah that has more than 140 cases involved. That is, I think, just trailing behind the Texas outbreak that happened. And so we are seeing it here in Mecklenburg. We're seeing more cases of whooping cough and pertussis than we've ever seen. We've had several outbreaks of whooping cough. And one of the things that I do want to sort of just double click on that Josh just shared is that it's really important to acknowledge that the families who are opting to not get their children vaccinated are clustering in geographic areas, in neighborhoods and communities, or even clustering by academic institutions. So their kids are going to the same schools. And so that's where we see the greatest level of risk, where we have a lot of kids in one school that are not up to date on vaccine, is where we really start to worry that if measles or rubella or pertussis gets introduced, then we start to see really large outbreaks. I think you'll recall last year there was an outbreak of polio up in New York, and so it is happening. And I think incidentally, outbreaks are getting attention, but I do think it's a true wake-up call for everyone that we have tools and we should use them.
Since people don't know about measles, many of them, because they've never seen it, because we've eradicated it up till this point, they've never seen these other diseases that we're talking about: pertussis, whooping cough, mumps, rubella. Take me through those very quickly. We don't need a whole medical school rendition of it, but tell me what mumps are and what they do to you and how dangerous they are.
Again, I think it depends on the virus, the person. So, given the amount of time we have here, I'll just say, mumps is also characterized very commonly by a skin rash, different than the measles rash. Whooping cough is again similar to a respiratory virus where people experience symptoms similar to other respiratory viruses. They can be very threatening to also not just children that are not vaccinated, but also older adults who have never been vaccinated are some of the folks who were dealing with the more severe consequences of the pertussis outbreaks, because these are folks who are older grandparents, great grandparents of children. And so, again, these conditions can all have varying levels of severity depending on the child, as well as depending on how many kids are infected.
The reason that vaccines work, as I understand this, is that if you get something like the measles, if you get 95% of the people vaccinated, you have achieved herd immunity. And there are vaccine naysayers who say, well, the same thing can happen if you allow children to get the measles. They get the measles, they can't get it again. As it spreads, more children become immune, therefore you achieve immunity, herd immunity. What's your response to that, Dr. Washington?
Yeah, I think that is the goal. I mean, the reason why we set our vaccination rate targets at 95% is so that the majority of kids in our community are protected. And because we can't fully control for individuals introducing a virus into the community, either from global travel or from other exposures that they might experience. But if we have most people protected, then the opportunity that the virus has to spread is contained.
But I think you misunderstood my question. My question is that some people say, well, that we can achieve herd immunity by allowing people to get the disease and becoming immune, and that therefore we're not taking the shot. What's your response to that?
Yeah, so I think that is the counter to sort of our using the tools we have available to us, right? Because to do that would mean that, for example, with measles, where anywhere from 1 to 3 children who are infected will, among 1,000 kids, will die. So that basically says we want to risk the life of 1 to 3 out of every 1,000 children to die to be able to achieve that when we have a vaccine that we know is highly effective and safe that achieves the same result. And so I think that would be dishonest, as well as it would also be dangerous to do.
Josh, I know you wanted to chime in here.
Yeah, I just wanted to add that, certain vaccines are very good at stopping transmission of infectious diseases, and measles is a perfect example of that. So the vaccine is very, very good at interrupting, this process of one person infecting another person. Not all vaccines do that, and that's not the goal of all vaccines. Some vaccines just prevent severe illness and death, which is an incredibly important outcome to prevent. But measles is so infectious, but yet the vaccine is very good at stopping this transmission. So that's why we need that high level of herd immunity. That same concept doesn't necessarily apply to all vaccines, but these common childhood vaccinations that we're talking about, yes, and they're very, very good at doing this. But if you see the defenses drop, then you start to see these outbreaks.
Tom, how would you describe the reaction of public health officials in your state as well as elsewhere, throughout the state, not just in Spartanburg County, but throughout South Carolina, as this outbreak of measles presented in Spartanburg? Did they regard it, would you say, as urgent? How have they reacted?
I think they've taken it very seriously, and we just to clarify, we are a statewide paper, so we have a bureau in Spartanburg County that is
Hmm.
also, following this very closely. But yeah, I think they've been on it. I think there is a lot of concern in areas of the state where there, are not cases. So, in Charleston, Low Country, we're, a couple hours away from Spartanburg, but I get calls from people who want to know, gee, I got vaccinated in the 60s. Am I still protected? Because that's a question people have.
And the
And
answer is
talk to your doctor.
okay.
But it probably yes, but it's not, probably yes, but it's a question people have. And so I think there is a lot of concern across the state, not just in Spartanburg County, but in that area, I think, we've seen the state has put mobile clinics in there to try and give the vaccine to folks who, are not vaccinated at no cost. And they've had, you know, not much uptake. Only 24 people have taken advantage of it over the past 2 weeks.
Really?
Yeah. So it's not really moved the needle in Spartanburg County to get people to go and get vaccinated.
We'll talk about why that may be in a second. But Dr. Raynard, what about if you had the measles as a child and you're in your 50s or you're in your 60s or you're in your 70s, or you had the vaccine at some point in your life for measles, mumps, rubella, for whooping cough? Are you immune for life or do you need a booster?
Yeah, and in general, folks should not need a booster and folks should have some level of immune response. But again, as people age, their immune system ages with them. And if folks have underlying health conditions or autoimmune conditions, then of course that immunity can wane and make them more susceptible to infections or reinfection. But again, that is a sort of a person by person. But in general, folks don't need boosters. They're not recommended. And if individuals have already had measles or been exposed, to the vaccine, then I think in general, we consider them taken care of. I will also note when it comes to outbreaks, which are, we have to manage on the ground really quickly. With measles in particular, because it spreads so quickly, we do have a very short window of time after exposure that we're able to vaccinate someone. And we do see if we catch people in that window of time, we've got like 72 hours from exposure to offer the vaccine. We do see better uptake in that window. Like if a child that's unvaccinated has been exposed, we tell them you've been exposed. Parents are moving. That is moving the needle a little bit more for some of those families. But as Tom mentioned, more broadly, sometimes people don't
Yeah.
respond until they're in the thick of it.
As I understand it, Tom, all of the people infected in Spartanburg were unvaccinated. And you report that some of the state's cases have been from travelers who ventured outside the state as of early this month. But as of early this month, the source of the original cases in Spartanburg County had yet to be discovered. Have they found it yet? Do they know where it started?
Not yet, no. And yes, they
Okay.
were all unvaccinated. They have sent off the strains, samples from some of the cases for further testing to see if genetically they can tell where it came from. Their assumption is that it's domestic, that it's from within the United States and from another outbreak area, either close by or somewhere else in the United States.
So we are told, Dr. Washington, by medical experts that the vaccine is the best protection against infection for measles. But when Texas began to experience an uptick in cases, Robert F. Kennedy Jr. recommended treating it with vitamin A. He's the head of the Department of Health and Human Services in Washington. He told Fox News vitamin A dramatically reduces measles mortality. And he mentioned that some were experiencing good results with a particular steroid and an antibiotic and cod liver oil. What's your reaction to that?
Yeah, Mike, I think I'll just lean into the first part of your statement. Vaccines are the best tool we have to prevent the spread of and impact of measles on our community. And I think that we should leave the decision making around individuals' healthcare up to physicians, their physicians, and I'll leave it at that.
Why? Why leave it at that?
Because I think the truth of the matter is, you and I have talked before. I think it's important that we are careful as public health leaders at the state, local, and federal level in our messaging, and what we say to the residents is taken with a level of credibility. And I do think that there's a lack of data to support some of the statements you just suggested. And so I do think, given the lack of information to support
That's
it,
my point. His
yeah.
his information, evidently, at least medical professionals say, it is inaccurate.
It
It
is,
is
yeah.
false. It is not true. It's muddying the waters. It is causing confusion among people, and that is dangerous. And if public health officials don't say that, who are we to believe?
Sure, and we've said it. I've said it to you before. It is dangerous, right? But in terms of answering your question about what's the best course of action, folks should get their kids vaccinated, and talk to their physician if they're sick.
Josh.
Yeah, I'd only say that, we can contrast the response that we've seen to measles this year, in general, with the last year we had large measles outbreaks, which was 2019, and they were clustered in New York City at that time. And, President Trump was in office at that time. And even then, there was a strong federal response through CDC, through the state leaders to that particular outbreak. And, I think we can contrast it with a sort of, as you reference with your quote from Robert F. Kennedy Jr., a lack of urgency, at least initially, when it came to this particular West Texas outbreak. Now, state level leaders are taking this seriously, as Tom had talked about, and I'm sure in North Carolina as well, but that's not always the case. And when you don't have that same sort of federal support, and we've seen an a cutting of staff and funding going from the federal government to the states for support for public health. That has an effect, and it's really challenging to mount an effective response in that case.
For whatever reason, this and many other things in science have become partisan issues. KFF Health News, which I am told is a separate entity from your organization, KFF, Josh, reports that more than half of adults, or just under half of parents, say they are at least somewhat worried about measles outbreaks. Democrats are more concerned than Republicans, and most adults and parents have read or heard some false claims about measles or the measles, mumps, rubella, MMR vaccines, which have sometimes been amplified, these false statements, by Robert F. Kennedy Jr. And KFF reports that, quote, notably, the shares of adults and parents who have heard the false claim that the measles vaccine is more dangerous than getting infected has risen by 15% since March of last year. And because this has become partisan, more Republican-controlled states are lowering the vaccine requirements. What's the implication of that on public health, Josh?
Yeah, it's a challenging circumstance for public health generally, and there's definitely still some good news and some bad news here. The good news is that our polling at KFF, nationally representative polling of U.S. adults, shows that people are in general supportive of vaccine mandates, like for measles, for school-age children. So 80% of U.S. adults, that includes Republicans, Democrats, Independents, are supportive of that. But it also means that there's a fracturing and politicization of this topic as well,
which is not healthy.
No,
literally and figuratively not healthy. We have to take a break. We're coming right back with more on the measles and vaccinations and more in a moment. It's Charlotte Talks on WFAE.
Coming up at 10, more than 400 anti-science bills have been introduced in state houses across the country. What do they mean for long-standing public health protections? That's on 1A in 20 minutes on WFAE.
Peter Sagal here from Wait, Don't Tell Me. If you're a member of this NPR station, thank you. It means a lot. Now, if you were looking for another way to help the station, you could, call up all your friends and ask them to donate on your behalf repeatedly at all hours of the day and night until they just give in to get rid of you or block your number. Or you could just donate a vehicle you no longer need. It's up to you. Annoy your friends or free up space in your garage. Your choice.
Visit WFAE.org/cars to learn more.
Support comes from the Charlotte Museum of History hosting their Mad About Modern tour on November 8th, a self-guided tour of mid-century and modern Charlotte homes that celebrate an iconic design era. Details at madaboutmodern.com. And by the Barclay at South Park, where senior living embraces a diverse array of activities and wellness programs designed to help enrich one's life. Information about maintenance-free residences, chef-inspired dining, and more at barclayatsouthpark.com. Support also comes from listeners like you.
It's Charlotte Talks on WFAE and WFAE.org. I'm Mike Collins. We're talking about the outbreak of measles in upstate South Carolina and other places around the country and what that means for public health and why it's happening. Dr. Raynard Washington is with us. He's Mecklenburg County's Public Health Director. Josh Michaud is with us. He's an Associate Director of Global and Public Health Policy at KFF. And Tom Corwin is a health reporter for the Charleston Post and Courier. I just mentioned, Tom, that more Republican, because this has become a partisan issue, more Republican-controlled states are lowering their vaccine requirements. We both live in North and South Carolina in Republican-controlled states. Is that happening in South Carolina? Are they lowering the requirements?
Yeah, there was an effort last year in the legislature to the bill was supposed to be focused on COVID-19, and they wanted to make sure that nobody was mandated to get a COVID-19 shot. But the way the legislation was written, it could have applied to any vaccine mandate. And so the bill didn't get out of committee, but it's been there. There are probably going to be efforts again. And the sponsors say they're not targeting childhood vaccinations at this point, but that could certainly happen. A lot of the vaccine hesitancy we see in South Carolina and the number of religious exemptions that allow parents to keep their kids from getting vaccinated have essentially doubled since the pandemic. And public health officials will tell you a lot of that was initially a reaction to the COVID-19 vaccine, but it's bled over to the other vaccines as well.
Dr. Washington, because of the pandemic, people became very upset in some circles with these mandates requiring them to have something injected into their bodies. And they say that my body is my body, leave me alone, I'll make the decision myself. And there's something to be said for that, on the one hand. On the other hand, we didn't lose millions of more people because of the COVID vaccine. People got the shot, and it essentially quickly ended the pandemic. The same is probably true of measles, mumps, rubella, all these childhood diseases that we're talking about. Where does my right to make decisions about my own body end and concerns for public health, the greater good, begin?
Well, I think that's all really based in our understanding of risk and science, right? And so as it comes to communities, and let's just take children, since that's the sort of center point here, kids go to school. That's an important part of what kids have to do. And particularly in public schools, kids should be able to do so without fear or risk of a lot of potential exposure to various viruses and conditions that we do have tools to help us prevent against. And so I do think that for many people, that is one of those lines in the sand where we should be able to go to school and have basic health and safety, which really is what about. It's about safety for everyone that's involved. And so I think that is what's really important for us as we think about when we have mandates and when we don't have mandates. For healthcare workers are another example. When people go to a hospital or healthcare facility, you really want to be able to go there and not get sicker because you went there, right? And so having healthcare officials, healthcare people who are working in healthcare settings protected is also important. And it's not just about their own, the individual patients coming into that facility. It's also about the workers themselves.
We achieved, Josh, in the United States, elimination status of measles around the year 2000. And we are now at risk of losing that status with these outbreaks around the country. If we do lose it, what will that mean?
Well, the elimination status was just a sort of reflection of a commitment nationwide to supporting vaccination for measles, and then that's a reflection of a broader sort of childhood vaccination effort. And if we lose that status, and what that means is that that we've sort of lost the plot when it comes to protecting children from these highly preventable diseases. Declining vaccination rates don't just have individual effects; they have community level, school level, family level effects. We put these in place in the first place to protect communities, not just individuals. And so what we'll see if we continue on this path is that we'll have more vulnerable children, more transmission of these diseases. And we also, the outcomes of that will be sick children, will be hospitalized children, and unfortunately more child deaths. And, unless we change the vaccination rates, it's going to be an unfortunate outcome here.
So there's no question, Dr. Washington, that the muddying of the waters from Washington is causing even greater fear and uncertainty about what I should do as a parent for my child. And I'm curious if the only alternative to that is what public health officials county by county are telling people, because perhaps local governments are more trusted than the federal government, or what your physician, your personal physician says. Do people tend to believe those individuals more than they believe what's coming out of the CDC?
I think so. I think a lot of recent polling has indicated that folks have still a fairly high level of trust in their individual healthcare providers, as well as local health officials. And so I think that's really important. I do think, though, it doesn't discredit or discount the importance of having a clear message from both our federal and state partners, because they do have a pretty significant audience, and that is, they dominate national media, and people consume that, and it becomes a part of the narrative.
Josh.
So we do polling here at KFF, and what you just cited is something that we found, particularly since the pandemic, because of the reasons you mentioned, COVID vaccine mandates and masking policies that came from the federal government, there was a decline in trust. People had a reaction to those policies, and a decline in trust, particularly among Republicans during the COVID response in the Biden administration. But now that we've seen, we have a Republican in office in the presidency, and we have RFK at the HHS, we've seen a decline among Democrats as well. And so there's been a sort of double hit to federal trust in federal authorities. And now I think it's about our latest poll showing 1 in 6 parents say that they have a lot of confidence in the CDC. But that's just to say that, as referenced before, people do still have trust in their local public health departments, in their providers, private healthcare providers, and that has been maintained despite the lack of trust in federal authority.
And yet, Tom, you mentioned these mobile health units deployed, and yesterday in their press release in South Carolina updating the measles outbreak, the South Carolina Department of Public Health also listed the locations and hours of operations in Spartanburg County for these public health units to get this MMR vaccine at no cost. And yet a very low number of people have turned out for that. Is that an indication that they don't trust the state health department, that they don't trust the Spartanburg County Health Department?
I think it's more that they haven't changed their mind about the vaccine itself. Interestingly, of those 24 people who have taken it up, 19 were adults and 5 were children. So not sure what to make of that, other than it hasn't moved a lot of parents to get their kids vaccinated. I will say the number of religious exemptions for Spartanburg County is 8%. So that's 1 in 12 kids has that exemption, and that's on top of other exemptions. So the vaccination rate is very low in Spartanburg County in some schools. In one of the outbreak schools, Global Academy, the rate is 17%. So it's not great. And it doesn't seem to have changed a lot of parents' minds at this point. So I don't know if it's a trust issue or they just it hasn't changed their mind about the vaccine, apparently.
Dr. Washington.
Yeah, Mike, I just want to be clear. We do a lot of work in public health to make stuff available to people, but it takes a lot more than just making it available. For it, it's not a they build it, you build it, they'll come always, especially when there's hesitancy. And so typically it takes a lot of conversation, even with an outbreak happening in a community. Those one-on-one conversations to help answer people's questions are what our teams on the ground have to do every day to move the needle. Just setting up a clinic is one step to access, but the verb of access is actually making sure that we get out there and inform people, answer questions, respond to, and are making it possible.
As I mentioned, some people believe that the vaccine is more dangerous than the disease. Is there an ounce of truth to that? Have kids died, become seriously ill, or were injured in other ways by getting the measles, mumps, and rubella vaccine? Dr. Washington.
The MMR vaccine is incredibly safe. Certainly, there have been vaccine events for every vaccine, for every medical intervention that's ever existed. Surgery, for any medication you take, there is the risk of something happening. I think for Tylenol, with anything, there's a risk. With an Aleve that you might take, there's a risk associated with it. So I can't say that there's never been a safety event associated with the vaccine, but I can say that for the vast majority of people, MMR vaccines are incredibly safe, and there is no reaction.
I guess the difference here is that if you take a Tylenol or some other over-the-counter medicine, you've made that choice. You haven't been told you must take it to go to school, and that is the difference. Would you say that's the difference here?
I think that's the narrative. I'm not sure it's a difference. I think the reality is that ultimately folks are recommended most medical interventions that they take, most prescriptions that they take. Someone's told them to take it in some way. I think the narrative, though, has been constructed that is sort of this government intervention, when in fact this is science and public health, not the partisan politics that you've described already.
Josh, in light of what's happening at the federal level, at the CDC and the Department of Health and Human Services, a lot of states have joined forces to form their own public health alliances. Which states have gotten together on that effort?
Yeah, in the past, month or so, there's been different regional alliances of states around, that have um, uh, declared that they've started these sort of alliances where they would work together in cooperation on health issues. And we've seen a West Coast Health Alliance, which includes, California, Oregon, and Washington. There's a Northeast Public Health Collaborative, which includes a lot of the northeastern states, New York, New Jersey, et cetera. And just recently, a few weeks ago, there was something called the Governor's Public Health Alliance announced, where governors from 15 states have declared their interest in forming a collaborative where they can share information and policies and eventually get to the point where they can set policies that would actually, sort of set them apart from what the recommendations and the policies that are coming out of the federal government. In North Carolina,
Is this bipartisan, or are most of the states getting
yeah, I
together
was just
in
going to
these
say,
efforts democratically controlled?
almost all cases here, we're talking about states that are democratically controlled for all of these different alliances. That's not universally true, but it's definitely mostly Democratic-led states.
So KFF polls show that a growing number of parents, including a quarter of Republican parents, agree with this statement: the risks of childhood vaccines for measles, mumps, and rubella outweigh the benefits. That idea predates RFK Jr. being in charge of Health and Human Services. So where is that idea coming from?
Yeah, this has been a reflection of this broader sense of the lack of confidence in health authorities and the recommendations, which is something that started even before the pandemic. We saw more exemptions in school-age children, dating back over 10, going back to 15 years nationally. And that got accelerated during the pandemic for all the reasons which we talked about. And I think, in our polls, we've seen parents express their more concern with side effects from vaccines, their lack of trust in safety of these vaccines, and a belief that these vaccines are not necessary, and that, parental choice is much more important a priority for them as opposed to protection of the community. And that's just been a reflection of this broader loss in trust, I think.
A lot of this comes from the pandemic and what we were told we had to do in the pandemic to be safe. And also we shut down businesses and quarantine people, etc. In South Carolina, Tom, in Spartanburg County, 124 students, I believe, were quarantined as a result of this for 21 days. That was one of the pushbacks in the pandemic, that people did not like the fact that they couldn't go to their favorite restaurant, they couldn't leave the house, they couldn't do this, they couldn't do that. What kind of pushback did they get in Spartanburg by quarantining these students?
Yeah, so the public health department handled it, I think, in a delicate way. What they did is they didn't issue a written order. I think they went to the schools and said, you need to quarantine these children, and they did. And so they'll tell you they got great cooperation from the schools in doing this, and presumably the parents as well. But again, the charter school, there wasn't a high vaccination rate. So apparently the parents accepted that, they need to keep the kids home for the 21-day that they need to be quarantined.
And it should be pointed out, Josh, this is not just happening here, it's happening around the world. There are rises in the incidence of measles in Canada and Mexico and Yemen and Pakistan and India. Do we understand why? Very quickly.
This is also a knock-on effect of the pandemic, not just nationally, but globally. We've seen a decline in childhood vaccinations that were interrupted in many cases globally. And so that's led to more, children who are unprotected and therefore seeding of new epidemics. And that has affected us because all U.S. cases, or all U.S. outbreaks are seeded initially through imported infections. And what we've seen now is that those imported infections now can cause more community outbreaks because we have these pockets of unprotected kids.
And finally, Dr. Washington, I have about 30 seconds. What are your recommendations as the public health director of Mecklenburg County about these childhood vaccinations? What would you tell parents?
Yeah, I tell every parent that the recommendation is to get and keep their kids up to date on the recommended vaccines as required or recommended by our partners in healthcare here.
And see your physician. If you don't trust Robert F. Kennedy, or you don't trust the federal government, or you don't trust Dr. Washington.
Or come to the health department and talk to our nursing staff or our physicians here. I mean, I think we're here and happy to answer any questions.
Dr. Raynard Washington is Public Health Director of Mecklenburg County. He was here along with Tom Corwin, health reporter for the Charleston Post and Courier, and Josh Michaud, Associate Director of Global and Public Health Policy for KFF. Thank you all for the hour.
Charlotte Talks is a production of 90.7 WFAE. Support for Charlotte Talks comes from Mazda of South Charlotte. Our executive producer is Gabe Altieri. The senior producer is Sarah D'Elia. The producer is Chris Jones. For more information on Charlotte Talks, to listen to past episodes, or to subscribe to the Charlotte Talks podcast, visit wfae.org/Charlotte Talks.
On Thursday,